Hello and welcome to our weekly Get Pregnant Now Quickie. This is your bite-sized fertility reset where we'll cover either one fertility boosting supplement or nutrient, one sneaky fertility saboteur, or one quick energetic release or mindset hack. So you can shift your body and energy in less time than it takes to scroll Instagram. Let's go.
Hey, beautiful soul. You're listening to the Rising into Mindful Motherhood podcast, your weekly dose of fertility wisdom. I'm your host, Dr. Katie Wood. I'm a barefoot mama bear, pharmacist, and integrative fertility coach. This is your go-to podcast for all things to naturally nourish your fertility, embody womb healing, and reclaim your feminine power to accelerate your path to pregnancy. My expert guests and I will be having intentional conversations to discuss the many facets of a thriving, fertile foundation, natural wellness, and how we grow and transform as women on our journey to motherhood. So let's dive in, shall we?
Hello and welcome. So today's technically supplement and nutrient is vitamin B6. So if your luteal phase is short, so really anything under 10 to 12 days, if you're spotting before your period, or if you have been told that you have low progesterone, then B6 could be your new luteal phase BFF. So, vitamin B6 plays a critical role in hormone production and progesterone support, especially during the luteal phase. That's the second half of your cycle after ovulation when your body's prepping for potential implantation. It also helps with dopamine and serotonin production. So if you're finding that you're dealing with mood swings, anxiety, or PMS in the second half of your cycle, then this could be a clue that your progesterone and your B6 levels are suffering. Because without enough B6, your body might struggle to produce progesterone, which is the calm and carry on hormone. And this can make it harder for an embryo to stick. And that's just a no-go if you're trying to conceive, which if you're listening to this podcast, then chances are you are. So let's talk about where you can get vitamin B6 from in your food, because I'm all about food first. Food is medicine. It is a foundational piece for your fertility. So grass-fed beef liver. Now, if you're not a fan of beef liver, not many people eat it. You could add it to things like meatballs or meatloaf, or they do make beef liver supplements as well. There's wild caught salmon and tuna, pasture raised chicken, turkey, potatoes, right? Let's put some butter on those potatoes, maybe a little bit of sea salt, and it's just going to taste so good. Bananas, pistachios, organic spinach, organic oats. If you've ever heard about seed cycling, during the luteal phase is when it's recommended to use sunflower and sesame seeds. And these are both going to be rich in vitamin B6 and other nutrients that can help support progesterone production. These foods are the best place to start, especially if you're wanting to optimize things naturally, which I hope you are. But if you're following a whole food balanced diet like what I just shared, and you're still seeing signs of an imbalance like pre-period spotting or mood swings in the luteal phase, then a supplement may be right for you. And something that you can look for, P5P, the active form of vitamin B6. It's pyridoxal 5-phosphate, and that's going to be easier for your body to absorb and use right away. And a typical dose of that could be anywhere from 25 to 50 milligrams daily, but make sure that you double check your prenatal. It may already include this. And of course, always check with your specific practitioner to tailor this and confirm that this is okay for your needs. And if you're asking yourself, how can I easily check my progesterone at home? I'm not actually really sure if my progesterone is low or not. I've got you covered. So, one great tool that you can use is an at-home device that measures a progesterone metabolite called PDG through your urine. So, typically, you're going to test 7 to 10 days after ovulation for a few days in a row to see if your levels are elevated and sustained. It's an easy pee on the stick way to get real time insight into your hormone health without needing to go to the doctor for blood work. And my other go-to tool for all of my fertility clients is tracking your BBT or basal body temperature. So after ovulation, you would expect to see a shift and rise in your temperature of about 1/2 to 1 full degree, and this temperature should stay sustained and steady until either a new cycle starts or a positive pregnancy test. And if there's an absent or lower temp shift that is maybe unsteady, that could indicate that ovulation either didn't happen at all or your progesterone is on the struggle bus. So that is your Get Pregnant Now quickie for this week. B6 for progesterone power and PMS support. Until next time, your baby is closer than you think. And a quick disclaimer, this podcast is for educational purposes only and is not a substitute for medical advice. Always consult your doctor or healthcare provider before starting any new supplement or protocol, especially if you're actively trying to conceive or undergoing treatment.
Thank you so much for tuning in to the Rising into Mindful Motherhood podcast. If this episode resonated with you or gave you an aha moment, stop what you're doing right now and write a review. This simple act of kindness helps me get this podcast out to connect with as many women as I possibly can. I also have a special offer. If you send me a screenshot of your review, I will take $250 off one of my premium coaching containers. Let me know what resonated with you the most and why. So connect with me in my free Facebook community or tag me on Instagram. You'll find both listed below. Thanks again from the bottom of my heart for tuning in to this episode, and I'll see you next time.